Based on the client's current medical condition, we're still in the same phase. What action are you going to take? So you know that 2 hours pass, the patient is coughing up pink frothy sputum, jugular vein distension, we got oxygen saturation of 85 at 4 liters per nasal cannula, respiratory rate at 38. What is your priority action? What is your next action? 1, activate the rapid response team. 2, switch to a non-rebreather mask at 2 liters switch to a non-rebreather mask at an O2 flow rate of 15 liters per minute. 3, assist the client to cough and debreathe. And 4, administer the prescribed morphine sulfate 2 milligrams IV to the client. There are also several strategies that we could use here. First strategy I can think of, do I need to call the rapid response team or do something now? In other words, is there something that I can do now that helps my patient with the current problem? Is there a nursing intervention that you can do as the nurse? So that is the question you need to be asking. So calling the rapid response team is not something that will help the patient immediately. So if I can do something that helps, I need to do that. So number 1 is out of the picture. So I have 2, 3, and 4. Am I really going to worry about asking the patient to cough and deep breathe in this scenario? In a patient that has jugular vein distension, 85 O2 saturation, all these respiratory problems? No. You need to do something to fix or help with the oxygen problem. That is the priority. So 3 is eliminated. 4, administer the prescribed morphine sulfate 2 milligrams IV to the client. What is the priority? The priority would be to give a higher flow of oxygen. Why? What is the client receiving now? 4 liters nasal cannula, O2 saturation 85. This is not helping. I need to do something else to help with the breathing problem. "15 minutes later, the client condition is the following. The patient is confused. Remember how the patient came to the ER? Awake and alert. Now he's confused 15 minutes later. Labored respiration. Look what happened to the BP. 80/40. Heart rate 65. Wow, that doesn't make sense. With that low BP, the heart rate should be higher to compensate, right? But the patient cannot compensate. Respiratory rate 32 and oxygen saturation still 84. After what? After the oxygen that you gave, that you increased the flow. Remember, that's into play. Your actions are into play, what you've done so far. Now they're giving you an ABG, so you have to interpret the ABG. I hope you know how to interpret an ABG, right? If not, there's a video here in our channel where I teach how to interpret an ABG. So pH is 7.30, acidosis, CO2 is 60. We have high CO2. So we have respiratory acidosis. The bicarbonate is doing absolutely nothing. So we have uncompensated respiratory acidosis and a extremely low pressure of oxygen that is 64. The normal is 80 to 100. Creatinine, borderline high, 1.1. BUN, same, 22. Sodium, 132. And potassium, 5.2. So here are new doctor's orders. Repeat the administration of furosemide. Insert a Foley catheter. 12 lead EKG. Assist with endotracheal intubation. And bolus administration of Ringer lactate with albumin, 5%. Highlight which doctor's order will the nurse implement. So this is a highlight type of question. So let's think of prioritization. What is the priority? What has been the core main problem now that the patient had? All throughout the case study, the patient has been declining respiratory wise. Is there an answer that deals with a respiratory response? Can I do this action and help with the patient's problem? Yes. Answer number 4. That is the correct answer. Now, does it make sense? Does the patient need intubation? Yes. Pressure of oxygen 64, decompensated or uncompensated respiratory acidosis. The patient is declining rapidly. We need to take care of that airway and breathing. Why not one? Why is that not the next action to take? The priority order to follow. So the furosemide will help with the edema. The creatinine, although is borderline high, 1.1, I can still administer the furosemide, but it will not help immediately with the respiratory problem. A patient in ICU definitely needs a Foley catheter to measure the output, but it's not the priority. A 12 lead EKG, it would tell me how the heart is doing, but it's not the priority over airway breathing. And I hope that nobody selected answer number 5, because administering colloids, albumin with crystalloids, LR, you're going to give more potassium, more water, and you're going to kill the patient. Why is that answer there? The BP is so low that nurses think, oh, low BP, I need to give fluids. If I give fluids, it will help with the BP. Yeah, but in this scenario, you will really kill the patient.